Sorry for a slight delay, but we have gathered some new information this morning. So I can advise that we have one new community case in Queensland. This person is a close contact of the person we identified yesterday from the aviation training facility. This person lives at Bargara Waters on the Gold Coast. We also have one additional case that will not be recorded in Queensland numbers as they were tested positive in New South Wales, but is a truck driver who has travelled on to the Gold Coast area, lives in Queensland and has been in the Gold Coast area from the 25th to the 27th of September. So that means we have 18 active cases currently. We did 11,208 tests yesterday, so we're seeing those testing numbers come up, but we want to see even more people coming out and getting tested, particularly on the Gold Coast as well now. We had 21,713 vaccinations, which now brings us to 64.58% first doses in Queensland, 45.6% second doses. So what these two new cases mean is that we will be extending immediately the directive in relation to mask wearing to the Gold Coast LGA as well as the Brisbane City Council and the Moreton Bay Regional Council LGAs that we announced yesterday. And we will also be putting the directive in place as far as vulnerable facilities in the Gold Coast LGA. So that will mean that there will be restrictions on people accessing hospitals, aged care, disability facilities and correctional services facilities. We will be monitoring this very closely over the next 48 hours, but we know that we need to be looking very closely, of course, at all of those close contacts that have attended the training aviation facility, and our contact tracers are working closely with the aviation, the airlines and also the staff that work at those facilities. Good news overnight, one of those hotels that one of the gentlemen stayed at yesterday, that all of those close contacts have come back negative overnight and they are now in isolation. So that's really good. That's what we want to see. The quicker we can contact trace and identify people, get them tested and get them isolating means we can contain this virus quickly in the community. So the message is clear today for anyone from South East Queensland, but anyone who's been travelling in these areas, please, if you have any symptoms, no matter how mild, a headache, a runny nose, please go get tested. We will be monitoring testing capacity on the Gold Coast and in the Brisbane City Council Moreton Bay areas. Again, working with private pathologists to request those on the Gold Coast to allow people to come in and get tested without needing a referral, and also just making sure that we have the times available for people to come in and get tested. We know that the virus is on our doorstep. We have been saying this for some time now, from New South Wales, ACT, Victoria. These cases reinforce this again. The genome sequencing that came back on the two different clusters yesterday show that this virus is not linked to any existing Queensland cases, that these are linked to interstate and potentially overseas. So that's good news. It shows that we don't have any evidence of the virus still circulating within the community from previous clusters, but it shows once again the risk to Queenslanders of this virus coming across our borders. So please go out and get tested.